Headache? A headache is pain or discomfort in the head, scalp, or neck. Serious causes of headaches are rare. Most people with headaches can feel much better by making lifestyle changes, learning ways to relax, and sometimes by taking medicines. What causes headaches? The pain you feel during a headache comes from a mix of signals between your brain, blood vessels, and nearby nerves. Specific nerves in your blood vessels and head muscles switch on and send pain signals to your brain. But it isn't clear how these signals get turned on in the first place. Common causes of headaches include illness. This can include infections, colds, and fevers. Headaches are also common with conditions like sinusitis, inflammation of the sinuses, a throat infection, or an ear infection. In some cases, headaches can result from a blow to the head or, rarely, a sign of a more serious medical problem. Strays. Emotional stress and depression as well as alcohol use, skipping meals, changes in sleep patterns, and taking too much medication. Other causes include neck or back strain due to poor posture. Your environment, including secondhand tobacco smoke, strong smells from household chemicals or perfumes, allergens, and certain foods. Stress, pollution, noise, lighting, and weather changes are other possible triggers. Genetics. Headaches, especially migraine headaches, tend to run in families. Most children and teens, 90%, who have migraines have other family members who get them. When both parents have a history of migraines, there is a 70% chance their child will also have them. If only one parent has a history of these headaches, the risk drops to 25% to 50%. Too much physical activity can also trigger a migraine in adults. Headache symptoms. There are many types of headaches. Although not all headaches are the same, they have at least one thing in common: pain. But many headaches also cause other unwanted symptoms, including nausea and vomiting. 1. Migraines. If you feel throbbing that begins on one side of your head and causes nausea or makes you sensitive to sound and light, you may have a migraine. Symptoms vary from person to person and from episode to episode. Different phases can often be identified. Prodrome. You may have a variety of warnings before a migraine. These include a change in mood, for example, feeling high, cranky, or depressed, or a subtle change of sensation, such as noticing a funny taste or smell. Fatigue and muscle tension are also common. Some people have food cravings, constipation, or yawning. Aura. This is usually a visual disturbance. Some people who have migraine get blind spots, called scotomas. See geometric patterns or flashing, colorful lights, or lose vision on one side, hemianopsia. Headache. Most people with migraine headaches feel nauseated, and some vomit. Most also become sensitive to light, photophobia, and sound, phonophobia, during a migraine. This phase may last 4 to 72 hours. Headache termination. Even without treatment, the pain usually goes away with sleep. Postdrome. Other signs of the migraine, for example, not being able to eat, problems with concentration, or fatigue, may linger after the pain has disappeared. 2. Sinus headaches. If you feel a steady pain in the area behind your face that gets worse if you bend forward, and if you also have nasal congestion, you may have a sinus headache. This type can lead to deep and constant pain in the cheekbones, forehead, or bridge of the nose. Pain that gets worse with sudden head movement or straining. Pain along with other sinus symptoms, like nasal discharge, a feeling of fullness in the ears, fever, and facial swelling. 3. Tension headaches. If you feel a dull, steady pain that feels like a band tightening around your head, you may have a tension headache. There are different types. Episodic tension headaches, happening less than 15 days per month. Pain is mild to moderate, constant, band-like pain or pressure. Pain affects the front, top, or sides of the head. Pain usually begins gradually and often happens in the middle of the day. Pain may last 30 minutes to several days. Chronic tension headaches, happening more than 15 days per month. The level of pain may vary throughout the day, but the pain is almost always present. Pain comes and goes over a long period of time. Symptoms of tension headaches include headache when you wake up, trouble falling asleep and staying asleep, chronic fatigue, crankiness, trouble concentrating, mild sensitivity to light or noise, general muscle aching. 4. Cluster headaches. With this type of headache, you'll probably notice intense pain on one side of your head. People often describe it as burning, piercing, throbbing, or constant. Pain behind or around one eye that doesn't change sides. Pain that lasts a short time, generally 30 to 90 minutes, but can last 3 hours. The headache will disappear, only to come back later that day. Most people with this type get 1 to 3 headaches, and some up to 8 per day, during a cluster period. Headaches happen very regularly, generally at the same time each day, and often awaken the person at the same time during the night. 5. Caffeine headaches. Have you missed your daily cup of joe? A headache may be on the way to remind you about it. Of course, too much caffeine can also lead to a headache. Caffeine is a stimulant, so both withdrawal and overdose can trigger a headache. It is safest to limit caffeine intake so that dependence and withdrawal do not occur. 6. Rebound headaches. These may be the most insidious headaches of all. Also called medication overuse headaches, rebound headaches can be caused by both over-the-counter and prescription pain medications. Rebound headaches can mimic the symptoms of tension headaches or even migraines depending on their severity. How can you tell if you are suffering from rebound headaches? Cutting off the pain medication and seeing how many fewer headaches you have is the only way to know for sure. Most headache medications are designed to be used occasionally, so be sure to check the packaging and not to exceed the maximum use. Some medications may cause rebound headaches even if taken just 2 to 3 times per week on an ongoing basis. 7. Hormone headaches. Headaches occur when there is a major fluctuation in hormone levels in the body. For women, this occurs every month, so it is no wonder that most headache types are more common for women. This can also cause pregnant women or women going through menopause to experience more headaches or migraines. 8. Hypertension headaches. Headaches that are brought on by high blood pressure pose the most immediate threat and may require emergency medical attention. Hypertension headache symptoms include pain on both sides of the head, pain that increases with activity, pulsating pain, chest pain, nosebleeds, difficulty breathing, numbness or tingling, blurry or doubled vision. How to get rid of a headache quickly. Are you struggling with a headache? Does it make you very uneasy and sick? And do you want to know how to relieve your headache condition as fast as possible? Here are 10 most effective home remedies for headaches relief in the shortest time, 100% natural. 1. Mixture of lemon juice and ginger. Ginger can reduce headaches by decreasing the inflammatory of your blood vessels. What's more, ginger also helps calm vomiting and nausea, common symptoms related to severe headaches. Mix the lemon juice and the ginger juice in the same amount. You should consume this mixture once or twice daily. Alternatively, mix 2 tablespoons of water with 1 teaspoon of dry ginger powder to make a paste. Apply this paste to your forehead for a few minutes. Another way is to place the raw ginger or ginger powder to the water. Boil it and steam the vapor. Apply it to your forehead for 3 to 5 minutes. 2. Lavender Oil. Lavender oil smells great and helps to relax. Besides, it is useful for soothing the problem of headache effectively. Boil around 3 to 4 cups of water in a pot. Add 2 to 4 drops of lavender oil to this pot of boiling water. Inhale slowly the lavender oil vapor and take a deep breath. Do this method to relieve your headache quickly. Note: do not drink lavender oil. 3. Cloves. Cloves contain cooling and pain-relieving properties, which make it an excellent treatment for headaches. They also help to relieve your pain caused by headache. Gently mash a few cloves. Place them in a sachet or tissue. When you suffer from headaches, inhale the smell of mashed cloves until you feel better. You can also mix 1 teaspoon of the carrier oil with 2 drops of clove oil. Apply this mixture to your forehead and temple and massage gently. Alternatively, combine 2 drops of clove oils, 1 teaspoon of salt, and 2 teaspoons of coconut oil well. Massage gently your forehead with the mixture. 4. Apple cider vinegar. Both fresh apple and apple cider vinegar can balance acid and alkaline levels in your body. Apple cider vinegar is used to prevent a headache. If you regularly face headaches, you can eat an apple with a small amount of salt and drink some water to take your headache away. Besides, you can add 2 drops of the fresh apple cider vinegar into a cup of water. Then you drink it 2 to 3 times per day. You can also use apple cider vinegar as follows. Pour hot water into a big clean bowl. Add 3 or 4 tablespoons of apple cider vinegar. Take a towel and hold it over your head. Steam for 10 or 15 minutes. 5. Basil. Basil can help you alleviate your headaches immediately because the analgesic present in it can calm your head. Make a basil tea by boiling 1 cup of water and adding 3 to 4 fresh basil leaves to the boiling water. Simmer it for a few minutes. Add a little bit of honey if desired. Now slowly sip this tea to relieve your headache. Pour water in a pot and add 4 to 5 drops of basil oil or fresh basil leaves to the pot. Boil this mixture. After that, you steam with this mixture. You can also chew some fresh basil leaves or use the basil oil to rub on your forehead to reduce your headache. 6. Lemon. Lemon is an effective and powerful ingredient used to treat headaches because it has refreshing and relaxing properties. It can also maintain the acid-alkaline balance in the body. Method 1. Squeeze a half of a lemon to extract the lemon juice. Mix the lemon juice in a glass of lukewarm water. Drink this juice. Method 2. Crush the lemon crusts. You pound into a paste. Apply this paste to your forehead. 7. Green tea. Green tea is an ideal remedy for headaches. It has a plentiful source of antioxidants that can relieve the pain caused by headache. Warm water. Green tea bag. 1/2 of a lemon. Instructions. Add a green tea bag to a cup of warm water. Squeeze a half part of a lemon to extract the lemon juice. Add lemon juice to green tea and mix well. Slowly sip the green tea. It will reduce your headache quickly after you drink it. 8. Cayenne pepper and lemon juice. Cayenne pepper is a good home remedy to treat migraines too. It can improve the blood flow along with stimulating circulation. Additionally, with the capsaicin inside, it can act as the natural painkiller. 4. So if migraines come and attack you, please follow these steps to reduce the pain. Add a half teaspoon or a teaspoon of cayenne pepper into a cup of warm water. Mix well. Add honey or lemon juice if you want. Drink the liquid in order to cure your migraines when they occur. 9. Beetle leaves. Beetle leaves help to calm the pain associated with headaches due to its analgesic and cooling properties. Ingredients. A grinder. 2 to 3 beetle leaves. Instructions. Put the fresh beetle leaves to the small grinder. Make a paste by grinding the beetle leaves. Apply this paste to your forehead and temple. Leave it on for 30 minutes. 10. Mint juice. Mint juice contains menthol and menthone that can reduce headaches. Ingredients. A handful of fresh mint leaves. Instructions. Firstly, you crush the fresh mint leaves. Then you apply the crushed mint leaves on your forehead and temple. Do this when you are suffering from headache to get rid of it immediately. Or you can place the mint tea compress on your forehead to get instant relief. When should call the doctor for head pain? Consult a doctor about your headache and find out what can be done for pain relief in these situations. You have a chronic medical illness such as high blood pressure, heart disease, heart attack or stroke, diabetes, or liver problems. You do not get relief with over-the-counter pain medications. You are taking any other prescription or non-prescription medications. There is any change in the normal pattern of your headache. You have a new type of headache that you never had before. You have pain in your face or eyes. Although headaches are very common, they may be a sign of serious disease that warrants immediate medical attention. Go to an emergency department if any of the following symptoms occur. Severe pain. Pain that develops very rapidly, sudden onset. A change in concentration or ability to think. A change in level of alertness. Altered speech. Weakness, numbness, or difficulty walking. Changes in vision. Headache with a stiff neck or neck pain, or if light hurts your eyes. Worst headache of your life. Headache with dizziness, room spinning, or falling to one side. Headache from an injury or blow to the head. Headache with fever, over 100.4 F or 38 C when taken by mouth. Memorize. Get immediate medical attention if your headache pain is different or more severe than you have felt before. Tell your doctor about any other symptoms you have along with headache pain.